You're watching the Randy and Christa Show. I'm Randy Alvarez.
I'm Christa Orecchio, and this is news that makes you healthier. And we are helping women of menopausal age today. Randy, we have a wonderful author of the Estrogen Window. Dr. Seibel's coming on. He's taught for Harvard for 20 years plus. He's a board-certified OBGYN, and I'm really excited about this topic because it's kind of new to me in my research, and I've learned so much about estrogen, which we've kind of formerly demonized or been scared of, to kind of bring it back now as a central component to women's health and wellness.
You know, the women I know that take estrogen swear by it. They love it. And then there's another group, because a lot of the people who've been on the show, we've talked about bioidentical hormones or hormone replacement therapy, and then some people are afraid of it because of some study, and we're going to ask them about it, and I want you to ask them about that on the show, about the dangers of getting breast cancer because of estrogen. But his book, What Every Woman Over 40 Needs to Know, this should be very interesting. He teaches, he's on faculty at Harvard.
Yeah.
OBGYN, board certified in infertility. So he's got a lot of stuff going on.
Yeah, it's got to be really interesting. I want to ask him about his story of how he went from working with infertility, because it's such a different crowd, right? It's such a different age, to now working with menopausal women. And I hope that we kind of can get a paradigm shift. You know, we were talking a little bit about the different types of hormones. I think we're going to kind of bust some myths that compounding is better versus, you know, FDA regulated hormones. So we've got a lot to talk about, and hopefully help a ton of women that are confused.
Because in the green room, I mean, he said to not be afraid of the hormones that are made by the drug manufacturers.
Yeah, which was new to me.
Which they
so I'm
guarantee the
excited to ask him
dosing and
about
things
that.
like that. So that'll be interesting. Okay, so let's go to your interview.
Okay, let's do it. You're watching the Randy and Christa Show. I'm Christa Orecchio, and this is news that makes you healthier. We are all about women of menopausal age today to help you get healthier. Such an important topic that affects the rest of your life. Here to talk about it is Dr. Seibel. He is a board-certified OBGYN, and he has been on faculty at Harvard for the last 20 years, and he is here to blow our minds with the latest scientific research on the menopausal hormones. Dr. Seibel, thanks for being here. Welcome to the show.
Christa, thanks for having me.
So this is, as we were talking in the green room, my mind was starting to become blown about this really big decision during this time in our life. And I would like for you to share your story of how did you start to research menopause and the hormones related to it?
It's kind of a very personal story for me, because at the time that just before I began, I was one of the country's leading infertility experts. I did one of the first in vitro fertilizations in the country. I even helped gorillas get pregnant at the zoo. But what happened was, in 2002, there was a report that incorrectly stated that estrogen caused breast cancer. It's called the WHI, or the Women's Health Initiative. And then what happened was, 7 months after that, my wife went into early menopause, had to have surgery that threw her into early menopause. And all of her doctors were reluctant to treat her because they were worried about the breast cancer story. Wasn't true, but they didn't know that at the time. So I basically had to figure it out so she wouldn't have to tough it out. And that's why I shifted. I say I used to do sperm to term, and now I do womb to tomb.
I love it, womb to tomb, which is what we're talking about today. And you've successfully helped your wife, Sharon, and now you're really helping millions of women with this, your new book. Congratulations, The Estrogen Window.
Yes, and actually, The Estrogen Window, it will be out in paperback too on September 19th.
Excellent.
And they have had the decision to change the title to The Estrogen Fix, but it'll be the same book with new title.
I like the window because it's really important for women to understand that they have this 10-year window where they can tremendously benefit from estrogen. And so first, let's just start out by defining what is menopause and estrogen, and then let's go into the window.
Okay. Well, first of all, menopause is defined as the natural menopause is defined as 1 year after a woman's last period. So they want you to go 1 year beyond. your last period so they know you don't have another period. Oops, it's not really menopause. So that's natural menopause. But if you're a woman of reproductive age and you have your ovaries removed, even if your uterus stays in, if your ovaries are removed, then that's called surgical menopause. And so you're in menopause at that time.
Which is what your wife went through.
Exactly.
Okay. Okay, so you're in menopause at whichever age, depending on whether it's surgical or natural.
Right, and it turns out that a lot of people think that menopause is for women in their 50s. And it turns out the natural age of menopause, the mean age of menopause, is 51 in the United States. But about 5 to 10% of women go into menopause before age 45, and 1% before age 40. So it doesn't have to be, quote, an older woman, and the symptoms can start up to 10 years before that. So we're talking about a huge span of women who could be entering into or beyond menopause.
And this is basically 20 to 30% of your lifespan. So it's important for every woman to know about it. I would say almost just to know about it starting at 35 and then all the way up.
It could be, and for many women it will start then, and menopause will even start then for a subset of women. And it's important to know because all of a sudden a woman will start having symptoms like fogginess or mood swings or can't sleep or her libido is a no-show, and things happen in terms of hot flashes, you feel warm, and palpitations of the chest and all these things, and people go to see 10 different doctors, one for each symptom, and they don't realize all under one umbrella.
All under one umbrella, which is hormones.
Yes.
Okay, so those kinds of symptoms, I mean, you've worked with women where they're literally, I mean, that's just so uncomfortable to live like that, and it changes your relationships, and like you say in your book, it can rob millions of women of their productive years of working.
Right.
Does any particular case study come out to you about a woman who had all of these symptoms and then was able to rectify them with estrogen and it changed her entire quality of life? Or you just have too many?
I mean, I've taken care of over 10,000 women.
That's extraordinary.
So it's an enormous number of women that I have seen, taken care of, and helped transition through this time in life. Most of the time, the people that I see will come in with one of two different categories. One of them is they come in with total confusion. They're not sure what to do. They're confused. They've heard this, they've heard that. This one tells them this one tells them that. They don't know. So people are looking for permission that it's okay to treat these symptoms with hormones. That's the first. But, there could be, an example could be Susan, who was doing really doing very well at her work. Things were going well. And then she noticed over the last few years that she was getting brain fog. She couldn't remember things. Things weren't going the way she wanted. And then what happened is it came to a head suddenly when she had a huge project that was a big effort for her. And she went to turn in, she had a specific deadline to turn in this project. And the deadline came and the deadline went. She did the project, was very proud of it, but she forgot to turn it in. So this impacted on her outcome of her work and how she was perceived and so forth. So she knew it was time to do something.
And hopefully our viewers today, which is why we're doing this show, is you aware of this. You can get tested, you can get checked, so you don't have to live out these issues and the things we were talking about, where you can have a positive effect to prevent early Alzheimer's, dementia, heart disease, all of these things that they progress if you miss the window. So let's talk about the different types of estrogen, progesterone, how a woman would go in, they would get tested, they're in their window, and how can they safely get treated?
Okay, well, there's a lot of things you've asked. So let me backpedal just for a second and just say there are two categories of women: women who have a uterus, and women who have had a hysterectomy and don't have a uterus.
Yes.
And so the women who do not have a uterus only need to be treated with one hormone, and that's estrogen. At least that's all they need to begin with. The women who still have a uterus need to have both estrogen plus some type of a progesterone hormone with it, because the estrogen by itself can build the cells up in the lining of the uterus, and the progesterone causes those cells to stop growing and potentially turning into a uterine cancer. Because progesterone is like progestation. It's all about pregnancy, and that prepares the lining for implantation of the embryo. Okay, so no uterus, uterus. The women who have no uterus get estrogen only. The women who have estrogen and progesterone, who have a uterus, get estrogen and progesterone. Then basically there are several kinds of estrogens that are out there, and I don't want to get too confused about this because the book goes into such detail explaining it. I mean, and there's like 11 pages of just index so people can find what they want. But basically there are the bioidentical hormones, which means that they're the ones that are made to be the same exact structure as the ones in your body. And then there are synthetic hormones that are out there that are other sources. And so let me stop there so that you have other things and I'll address them as you bring them up.
Well, it's interesting how, as we were talking in the green room and you started talking about estradiol and the difference between FDA-approved hormones and compounded hormones. Now, we've interviewed functional endocrinologists on the show and people who have been very pro-compounded pharmacies. I myself work with a compounded pharmacy. And so share the pros and cons of both, working with the FDA-approved and regular pharmacies versus compounded pharmacies, if you would.
Well, the first thing to say is that both chain drugstores, and compounded pharmacies do a lot of good things. But there are some fundamental differences between them. The one is that all of the medications that are in the chain drugstores are FDA approved. Whereas the ones that are in the compounding pharmacies are made one at a time as you come in. They're not FDA approved. So you just have to be aware of that. And the other difference is that when you get a dosage from the chain drugstores, it's been tested in quality assurance. Whereas when you get the compounded pharmacy hormones, they're not tested specifically to see that the values are what was ordered. And that's a potential concern.
And you've mentioned some studies before where the doses weren't standardized when they've been compounded. So we think we're taking a specific dosage and it could be either much higher or much lower. So there's the plight
Well, let me explain that, because just very quickly, that in a study done a few years ago, one prescription was mailed to 12 compounding pharmacies. The prescriptions were filled in 12 different places and then mailed to a reference lab that just does chemical analysis for what's in this stuff I got. And what they found is that the compounding pharmacies in general, none of them had exactly what was on the prescription. And in general, estrogen was between 60 and 200% more than what the pharmacist had ordered, or what the doctor had ordered. And the progesterone was 60 to 80% below, meaning that women in general who get compounded hormones are getting a higher dose of estrogen and a lower dose of progesterone than they think. And that can have implications they should be aware of.
Scary implications. And so now you just need to trust that compounding pharmacy and ask if they are testing the dose before that goes out the door.
Well, you can ask what the quality assurance is in a compounding pharmacy, but if you do go to a compounding pharmacy, not to scare anyone, what you must do is you're going to have blood sampling done to see that your levels are appropriate. At least have that done. And if you're taking estrogen, you want to check the lining of the uterus every year or two to make sure it's not getting too thick.
So don't guess at it, test it. Don't be afraid of compounding pharmacies, but it's the same thing.
Be proactive in your own health.
Test every 6 to 8 weeks if it's a new hormone is my general.
Well, till you know you're at a certain level, but I mean only a couple of times ought to tell you.
Right. So in the later chapters of your book, I love how you talk about estrogen's impact on the brain, the bones, the bladder, the vagina, the breast, everything, to really understand. So in our last couple of minutes, can you talk about estrogen's effect there? And then what I love is you talking about the sum total of a woman, because we're not all these individual parts. And so can you go from the part to the whole here?
Yes, indeed. What I wanted to, I guess the quick summation is that when I view patients, or when I view women that I coach long distance by phone or over the computer, basically you have to look at someone as the sum of you and not just, like some of you. The benefits of hormone therapy, if it's appropriate for you, is that it is something that goes to almost every cell of your body, your brain, your breast, your bones, your bladder, everywhere. When you treat with alternative approaches, which I also address in the book, you're only treating one part of you, the symptom that is in question. So you have to think in terms of the sum of you. And what's so amazing is that all that brain fog is because estrogen increases serotonin in the brain, and it makes your synapses in your brain work quicker. So your reflexes are faster and your thoughts are quicker. So the brain fog goes away and your thinking is more efficient.
Well, you're happier.
You're happier.
Sleeping better.
Well, sleep is affected. That's also central. And, you know, in terms of the intimacy, the vaginal tissues respond to estrogen in such a positive way.
Right.
And most of the time for women who have painful sex, the symptoms don't start until about 3 years after menopause. And so they don't equate it with menopause. And only 7% of women get treated for painful sex in this country. 50% of women have that problem, but they don't ask. They don't tell their doctors, and the doctors don't ask about it. So the original don't tell, don't ask was actually right in this. Today, 7% only. So if you have that problem, for goodness sakes, tell your healthcare practitioner.
Right. There shouldn't be any topics that are taboo, and especially sex provides closeness and intimacy and all those other positive hormones that come from it, and we don't talk about it enough.
It also makes you feel good about yourself because it's a closest. And that's the whole part. It's like, it's not only how you feel about work, which is affected greatly potentially. It's not only how you feel in terms of other relationships, because you may be more moody and not react in the way you want, but it's also how do you feel about yourself. And all of this self-esteem can be affected by treating the sum of you with hormones, with proper emotional support, with lifestyle changes that can be beneficial, and so forth.
I thank you for writing this book and helping us to no longer demonize estrogen, first and foremost. I think that's profound, and I'm just thinking of, I almost want to apologize to previous clients, right, that are beginning with osteopenia or osteoporosis and not connecting the lack of estrogen to them being in menopause. And so I feel like the takeaway is to empower women. There's just so much that you can do, even if in our last few minutes here, we have just another minute left. So even now, a woman is having estrogen, whether they're 3 years, 5 years, 7 years into menopause, get checked. Get checked and get tested and get support. But what about the women who are out of that window? What's your suggestion for them?
The window of greatest safety and opportunity is the first decade, the first 10 years after menopause. But if you are a woman who goes beyond that time, you can still use local or vaginal estrogen, but you must take care of the sum of you. About 7% to 10% of women can still use hormones at that time, but you have to talk and be individualized. Talk to your healthcare provider, but don't leave out the lifestyle, don't leave out the mindset, don't leave out the spirituality, and don't forget to take care of the sum of you, because time spent on you isn't lost, it's invested. And the ROI on that is better health, better happiness, and a better hormone balance, quality of life.
Quality of life.
Yeah.
It's been a pleasure, Dr. Seibel. Thank you so much for being here.
My pleasure. Thanks for having me.
Thanks for being here. We'll be right back.
You're watching the Randy and Christa show. I'm Randy Alvarez. Christa, very interesting.
It was interesting, right? And it's just the fact that you can have a totally different woman before estrogen replacement versus after in terms of symptoms and quality of life. I mean, the disparity is so poignant.
And now this book, like you say, you're new to the hormones. What's your take? After talking to him, we've spent some time in the green room interviewing him.
Yeah.
You like estrogen now?
I do, absolutely. And I want to make a public apology to any client who had come to me in menopausal age and I wasn't aware to bring up estrogen to them, right? If I could make these types of interviews make me want to go back into private practice, because a woman is coming and she's headed towards osteoporosis, osteopenia, heart disease. You only have so many tools in your toolkit to help them, whether that be gut health and inflammatory process and lifestyle, but this is a really key component. And if we can preemptively get this information out now to women in their 40s, late 40s, even 50, while they're in that window, right? They're going to have a totally different second half of their life than they would if they miss the window. And so this is why that was just so inspiring for me.
Okay, Christa, so you're going to send this out to your people.
Yeah, so we're going to do a giveaway. We're going to give away 3 books on the blog.
nice.
And so whether it's to your mom, whether it's for you, we just really need to spread this information far and wide.
Okay, good. You've been watching the Randy and Christa Show. I'm Randy Alvarez.
I'm Christa Orecchio. Thanks for being here.